I watched the over 2 hour testimony of the CDC director on COVID-19 policies during the pandemic, and I want to bring up all the systemic failures of the CDC in terms of how they operate. I'll do the politics of all this in another video. The first being that the CDC received all of their data by fax. 3,000 different jurisdictions were faxing the CDC data daily. Number two, none of this information was standardized. All of the data was received voluntarily. This means we didn't get race and ethnicity data, we didn't get zip code data, and we didn't get vaccination data. At this national level, what they did get was case hospitalization data, hospital death data, but they never received any information on people that were vaccinated and hospitalized or vaccinated and died, so we don't know the stats on that. Furthermore, as everything was manually done by fax machine. There's no data highway system, as they called it. There's no way for them to receive data, process it, and then be like, all right, we're seeing a spike in county A, we need to inform county B, C, and D and the surrounding areas to let them know what's happening. The craziest thing about this is that they were given hundreds of billions of dollars to be able to process these emergency health records. So the states were collecting all of this info that they weren't able to get at the national level. They weren't able to receive. It was like a game of telephone. You have the hospitals collecting detailed information, you go up one level to the state, you lose a bunch of information, you go up to the national level, you lose a bunch of information, and we're just losing data. And I think this is the fourth point. The CDC has always been a physician-directed service. Because COVID was politicized, they were thrust into the national spotlight, and you had the CDC director going on the Rachel Maddow show and things like that. Because of this, they didn't have a liaison that is able to translate between the science and in layman's to the people. They didn't have a good science communicator, which then resulted in the CDC not being consistent within their guidance because they didn't know how to communicate to the average person. They only know how to communicate to physicians. And then going back to the data to highlight a previous point, there's no real-time processing. If the CDC had a good online data service, they could have been near instantaneously collecting data, predicting outbreaks with predictive algorithms, and then focusing the resources needed in those targeted areas to prevent outbreaks from blossoming. And then finally, due to the end of the public health emergency, that government funding, the CDC no longer has the authority to collect COVID data, which is all to say that our American Infectious Disease Agency, the CDC, has been exposed to be quite lacking, with all of these areas being places we need to target to improve to help people during this current pandemic and for whatever could come next.